If you're undergoing IVF and experiencing recurrent implantation failure, it's absolutely heartbreaking. You're so close to your dream of holding a baby in your arms, yet simultaneously so far. I know that you want to do everything that you possibly can to optimize implantation, so in this video I'm going to explain the 5 key considerations from a nutritional viewpoint. Stay tuned. Hello, if this is our first time connecting, welcome. My name is Melanie McGrice and I'm a fertility and prenatal dietitian. I help couples boost their fertility and give their babies the best start possible with the power of good nutrition. Make sure that you subscribe and connect with me on social media. Recurrent implantation failure is defined as having 3 unsuccessful IVF attempts with good quality embryos. An unsuccessful embryo implantation can be a consequence of the health of the embryo or of the health of the uterus. Now, when it comes to increasing your likelihood of implantation, nutrition can play a key role. So let's discuss 5 of my common considerations for clients who are experiencing recurrent implantation failure. Number 1, endometritis is an inflammatory condition of the lining of the uterus. It's commonly caused by an infection such as tuberculosis or a sexually transmitted disease. However, dietary factors can impact inflammation too. If endometritis is an issue for you, speak to your fertility dietitian about following an anti-inflammatory diet. Now, number 2, autoimmune conditions such as celiac disease, lupus, type 1 diabetes, ankylosing spondylitis, and multiple sclerosis are also associated with chronic inflammation, which can prevent implantation. However, in this situation, an anti-inflammatory diet may not be adequate. So firstly, undertake testing with your healthcare team to look for autoimmune conditions. Then, with the help of your fertility dietitian, adapt your diet to minimise any autoimmune conditions that you may have. For example, if you have celiac disease, you'll need a strict gluten-free diet and nutritional supplementation, whereas if you've got type 1 diabetes, you'll need to optimise your glucose levels. Number 3, another common factor that can impact inflammation of the uterine lining and consequently reduce implantation is excess body fat. High numbers of fat cells, called adipocytes, trigger an inflammatory cascade which has been linked to chronic low-grade inflammation and increased rates of implantation failure. A reduced calorie, anti-inflammatory diet may be beneficial in these cases. Now, number 4 is anatomical abnormalities. So fibroids are non-cancerous lumps of tissue found in the uterus. They're really common and usually don't cause any problems. But if they're in the wrong spot, they can cause implantation failure. So for dietary tips on reducing fibroids, check out my video. And finally, number 5. A thin uterine lining can also minimise your chances of implantation. Medical techniques are the primary treatment for thickening the endometrium. However, nutrition can play a role. If you have a thin uterine lining, make sure that you check out my video on this. And finally, research suggests that some foods and nutrients are more beneficial for optimizing implantation rates than others. Omega-3, zinc, and melatonin are good examples. So, if you've optimized any inflammation as much as possible, discuss the risks and benefits of these nutritional supplements with your fertility dietitian. Now, to get you started, I'd recommend downloading my free fertility meal plan. Just go to www.melaniemcgrice.com/fertility. And I look forward to seeing you in my next video. I'm a little sleepier. Yep. Thank you.